Okay, thank you. Do we have these lights on? Shining in my eyes. Is it possible to turn those lights down or off or play around with them a little bit? Aha,
Oh, that's turn them off.
that's turning them off. What about these here?
There.
There,
Yeah, work-
okay.
Does that work for you?
Okay, that's fine with me because they're over my head, so, okay.
Did you shut the door?
Mhm.
Keeps the
Yeah,
distractions
why don't you?
in. Sure.
Now it's authentic. Okay, we'll start with just sitting. Paying attention to our breath. Paying attention to our body in this space. Noticing our weight. Relaxing. Noticing our hands. Noticing areas of tension, maybe in the jaw, or in the neck, or in the shoulders. Paying attention to our breathing, the in-breath and the out-breath. In-breath and out-breath. Breathing naturally, but noting the pause between the in-breath and the out-breath and the next in-breath. Letting go of thoughts that might intrude, thoughts of our day-by-day affairs. Just pay attention to each breath. Notice our body sensations. Let them go. Go back to the notice and the concentration on our breath. Out breath can be relaxation, can be gentleness. In breath can be taking in some energy. Then out breath again, relaxation. Notice what you're hearing. Just notice it. Don't name it. No value, just judgments about it. Just notice it. Notice how we put it aside. We just notice it, but we don't delve into it. And the same for our thoughts right now. We just notice them. Coming back to our thoughts, going a bit beyond noticing them. Notice if they're future thoughts, thoughts about the future. Notice if they're thoughts about the past. Then let them go. Notice if they're pleasant thoughts or if they're unpleasant. And then let them go. Just breathing. welcome, and thanks for coming. I had hoped we would have an audience, and I'm so pleased that we do. As some of you know, this got started because of Michael's schedule, and he was going to only do 6. And I talked to him about that and indicated to him that the last 2, mindfulness about emotions, difficult emotions, and mindfulness about physical pain, were very valuable to my wife Celeste and to myself during her very long illness and her ultimate passing. I myself am not a stranger to illness. I've had my own challenges, and the practice of meditation has helped me in ways that are very difficult to define, and helped Celeste and I during that very difficult period, which are still being parsed out by myself, and very difficult again to put into some kind of a list or some kind of a how to do series of ideas. But I want to give you some insight in the things that Michael gave us through these last two sessions in the previous time that Celeste took it with me, and then the last time where I took it alone with a group similar to this. And I'm not trying to be Michael. My voice doesn't match his in terms of quietness, and my demeanor perhaps doesn't match his in terms of peacefulness. But I do want to pass along some of the things, some of the handouts that he would have given you if we had been here. I also want to take some time where we can just meditate tonight together, looking at a few different aspects of pain and emotional pain. And that is what we'll come up with tonight. He no doubt will be watching this if this thing is actually working. I don't know whether that means anything that's up there. But at any rate, I'm kind of interested in apprenticing with him for his prison outreach. I think some of you knew that before. I worked in the prisons for almost 10 years, and this is a practice that would be very helpful for inmates and for anybody that serves inmates in an educational or a mindfulness capacity. And I really would like to join him and his partners in this effort. So in a sense, this is kind of a way to practice that and to begin that.
That's awesome. Yeah.
So take a moment to what's going on here, something's anyway. So what do you have to share tonight about your practice, about your hopes for this evening? Anything really to get started.
I think for me, my meditation probably hasn't been as consistent as I'd like, so that's my goal. I'm curious about what you have to say tonight, of course, but just in general, still working on it. Still working on carving out kind of a consistent time. My schedule isn't always allowing that, but still working on it and not giving up yet.
Good. It's hard. It's hard. I still struggle.
I kind of feel the same way. I've been trying to do it daily, and for the most part I've been doing it daily, but sometimes I feel like I'm rushed because I'm thinking about what I have to do for the day. So I'm like, okay, I have to sit down and do this for 20 minutes. So I'm not always sure, and I know that's part of the process, but I try to keep coming back to the breath, but there's a lot of thoughts. And then I still think if I can find 30 minutes, I feel for me, the first 15 minutes or so is thoughts and trying to get past it. But once I get past all that, then I feel more zen, but I don't always have the time to do that. or take the time to do that. So that's my struggle, is to still figuring it out. And I'm curious in what you have to say today about the emotional and physical.
I would say I feel like a rookie. Sometimes I really focus on certain people as part of my meditation, like wishing well, but just like, okay, what are their strengths? What are their, what are they hurting from? So I tried that sometimes, I start with the body scan and then I kind of tray off to that. And so that's helped me, doing the two things. I'm doing the body, breathing, awareness, and then I try to focus on something else. So, yeah, I'm still going, and I'm very, very curious as to what you're going to share tonight. Yeah, anxious to find out.
Doing the loving kindness, that I do nearly every day. I don't always sit quietly and meditate, but probably every other day I can get that in. And yeah, I'm anxious to hear what you have to say, what your ideas are.
And for me, I guess, for the most part, I have a pretty dedicated practice. It varies in time length. I try not to get too caught up and hung up on it. If people wake up and it's only been 10 minutes and there's too much busyness around me, I just say, oh, well, I guess I'm done. And for me, I'm really looking and working on embedding this into just being mindful all day long and finding pockets of time to practice all of these things. Much like we've joked about, whether you're doing dishes or brushing your teeth, but also in the car, not having the radio on all the time and just letting it be quiet and observing what I'm thinking about while I'm driving. And I truly found these last two classes, I feel, could easily be a 6-week course in themselves, because for me particularly, the physical pain piece has, I think I mentioned before, just the strategies have really helped to alleviate whether it's my obsession over the pain that I feel or the pain is actually leaving. I don't know, but very helpful. So, thank you for offering to do this.
Thank you.
I'm very excited to be here.
Well, my story begins with a diagnosis of prostate cancer, and I went through the radiation, and I'm not going to go through the whole thing, but that was not painful, but it was difficult, and it was emotionally difficult. And Celeste suggested that we go take Dr. Hetzner's meditation class. She saw there was an ad in the paper, or it was in the notice of the library or whatever. And I guess I was a little bit skeptical, but I wanted to do it. And this was before she was ill, and she was thinking it would be useful for me and for her as kind of a caregiver. And we took the class, and it really was very, very good for us to take it together. We discussed it frequently. We didn't meditate at the same time, but we discussed our meditation practice with each other quite a bit. Very shortly after that class was over and my treatments were over, she went to the doctor with sort of an unspecified pain. She thought it was a broken rib kind of thing being reactivated. And her caregiver said, no, we better get a CT scan. And upon looking at the CT scan, she suspected lymphoma, large B-cell lymphoma. It turned out to be after a biopsy that was very difficult. And right after that biopsy, she began the R-CHOP chemotherapy regime. We were both very scared, and that fear was also had an element of anger. Thinking about that wheel that Michael shared with us the other day, there were a lot of aspects to that fear besides the fear itself. And the anger of why us, why this, and then of course some hope and curiosity that this would be cured, because we found people that had been cured, and that was very good news, and we moved forward with that. The chemotherapy, of course, was very hard, and as a caregiver, I had a bit of an advantage, because when I was 40 years old, I had another form of cancer with a very rigorous chemotherapy regime that lasted a whole summer. Because at that point in time, well, they knew that the chemotherapy was likely to be effective, they didn't know the dosage. Now the people that get it would get a third of the dosage, and this made me very, very ill. I had to continue to be in the hospital. Celeste was a caregiver in a sense, but she had children at home, and so I was mainly in the hospital alone during this period of time. But I knew some of the tricks for chemotherapy, that if you're eating and your soup tastes metallic, you discard the metal spoon and you go to a plastic spoon, and there's all kinds of little things like that. There's books that tell you what to do, and I worked with her on that, but it was still a very difficult road because she had never experienced anything like this. She had never been really sick at all. Well, the R-CHOP did not work, and further biopsies suggested that maybe it worked, but then it confirmed that it didn't work. So then she was aligned to have a consult concerning a therapy called CAR-T. And CAR-T is where they take your T cells and they modify them to attack your specific cancer. It's an up-and-coming thing. It's FDA approved, but it's very difficult and it has a lot of problems of its own. And it takes a long time to get the insurance in place, and a long time to schedule it, and a long time to get your own head wrapped around it, both as the patient and as a caregiver. So we went through that period where her health was relatively good on the outside, and we had some very, very good times with family and with friends. We attended a professional scientific conference on the monarch butterflies, which was her big deal, preserving and helping the monarchs. And so we went to that in Kansas, and then as we approached the holidays, she started the protocol to get the CAR-T, and that involves harvesting the T cells and getting all kinds of tests to make sure that you could survive it. And then after Christmas, we checked into a place called Kathy's House, because the CAR-T pretty much wipes out your immune system, and you have to be isolated, and your caregiver has to be isolated. So we moved in there knowing that that would be a period of about 6 weeks. So that was difficult. We could get food deliveries and limited visits at a distance, that kind of thing. But in a way, it was like being in prison. And there was a caregivers group, support group there among the caregivers of the other patients. And I joined that very quickly. I found that was helpful when I had the cancer when I was 40. And so I thought, as a caregiver, maybe I'll benefit from this. And indeed I did. And as people kind of came and went, I became the head of that caregiver group. And then after about 6 weeks, we found out the CAR-T did not work. And there were some other possibilities for therapies, but by that time her condition had deteriorated so much that she wasn't really eligible for it. Some of that was due to the CAR-T and its side effects. Some of it was just due to the fact that the lymphoma was progressing. And a part of that was she had an earache, and the earache got more and more severe. And can you imagine, for week after week, month after month, having an earache and nothing worked? And then they decided on surgery for her ear, and they felt she had an infection, so they gave her all kinds of antibiotics, which really went after her gut flora and made for a very difficult time. And then they were still watching to see if she could possibly get into another therapy, maybe a stem cell transplant or something. But then her liver was failing and her pancreas was involved, and the part in the ear was noted that was lymphoma. And lymphoma is a blood cancer. Even though it clumps up into tumor-like masses, it can move around in your blood. And as the doctor, was talking about possible future therapies, she decided she wanted to go home. And she wanted to do home hospice. And we had talked about this over and over and over again, and I was on her side. My daughters had a difficult time with that. We meditated on it. The meditation by this time was not particularly helpful in terms of the physical pain. It sometimes was helpful for small aspects of it. It was more helpful for emotional difficulties and bringing her peace with her decision, bringing her peace with the fact that our daughters were just heartbroken that she was giving up. And even though there was really no aspect of giving up because she couldn't get the therapy, she would have if she could, but she just wanted to go home. And she went home, and the first month was reasonably okay, and she was pretty much confined to her bed the last part of that first month. And then the second month, she was always confined to her bed. She couldn't go out on the back porch and enjoy being outside or anything like that. She had all kinds of physical difficulties. As a caregiver, it was very difficult to make sure that I had meals for her that she found tasteful, and to be aware that sometimes the meal would be presented and she just couldn't eat it, or it wasn't appealing to her. And keeping her dignity, keeping her clean. And a lot of this was up and down the stairs, so physically it was difficult. I also had to manage her medication, and always being afraid that I would make a mistake, and having charts and things to go over that day after day after day. And of course, she had to have meds every 4 hours, so sleep just plummeted. So I was being damaged, and I knew it, but I had no other choice. I had to be for her. She's my sweet lady, and that did not change. And our conversations continued when she even couldn't talk very well, when it was in her jaw, when she couldn't eat. She could still savor some of the things I made, but mostly not, and she was wasting away. Toward the end, the last week, her breathing got shallower, and the medications that she needed to control the pain were stronger and stronger. And her lucidity was still there, but for limited amounts of time. She never really lost her lucidity, but she could only talk to you or engage in some type of interaction for a limited amount of time. And she passed in a hospital bed down in her dining room. During the last 2 weeks, she was confined there. After 1 week to modify her medications down at the hospice center in Sheboygan Falls, they took her down there, and she came back and she went downhill. She didn't wasn't really aware that she was in this hospital bed, and became less and less aware, and less as we had to increase the morphine for pain in her abdomen and her particularly her ear and her head. It was in the bones now of her head, and she passed quietly with my daughter and myself at her side. So that's the story, and there is another sub-story here, and that's that I just spun into a downward spiral after she passed. They had to postpone the funeral because I was in no shape to do anything, really. I was almost catatonic. But with the help of a good psychiatrist with good pharmacology, with the help of Michael, who stopped by frequently to visit Celeste and me, and then me after she had passed, and other good friends, I began to slowly pull myself out of that pit and start thinking about how to rebuild my life. And part of that was getting involved last fall in this group again, and to see where that might take me, and becoming more aware of spirituality and how that had been missing in my life, being aware that I needed to meet new friends, not just the people that Celeste and I had been with over the years, but new friends that had new interests and new ways of looking at things. And here we are. So I don't know if you have any reaction to that. I would welcome it if you do. Otherwise, we'll move on.
I think what you did for your wife is remarkable. Not everyone can be a caregiver like that. Not everyone can be a caregiver till the end and do what you did. So she's a very lucky lady to have you.
Well, thank you for those kind words. I would like to believe that. In looking back, I mean, sometimes people say, are there any regrets? And I have no regrets.
Right.
I did what I could,
Yeah.
and I went beyond that even. And she attested to that throughout this whole thing. She considered herself very lucky, to have me by her side, and I was literally by her side, except when I was preparing meals or ferrying the meals up from downstairs or taking her out on the porch, and keeping her clean, keeping her spirits up as best I could.
Yeah.
Meditating with her, doing loving kindness with her, which was one of her favorites.
That's truly the meaning of marriage and till death do us part.
Yeah.
It's a testament to that.
But I just think it's so touching how you're able to talk about her. I just think some people just shut, and it brings me like a happiness or a proud that you're able to talk about her, or that we can help remember her. And yeah, that's touching to me. How maybe throughout the past weeks how you would bring her up, and it's like, oh, I like that.
Yeah, and that has helped me
To be able to talk about
to be able to talk about it. I'm part of a support group that is run by the hospice that she was with, and we meet once a month, Mondays, and a lot of the people there are having a great deal of difficulty moving on, and they have a great deal of difficulty talking about the loss of their loved one, their grief, and certainly not the details of what goes on. And cancer's not pretty, and to kind of face it and acknowledge it the way we've been taught by Michael, that next step, and we'll do a little meditation on that in a little while, but to acknowledge it and then to turn towards it certainly helped me convince myself that I did everything I could, that she had the care that she needed and wanted, that she had a passing that was relatively peaceful, and that ultimately my daughters would come to feel that way, and they have. And if I hadn't turned toward it, that wouldn't have happened. Turn toward it means for me that I discuss it with trusted friends, I discuss it with myself, with my own soul, and with treasured friends like Michael, who have a lot of answers. Michael was my own physician for a long time. He was our family physician. He birthed my middle child, so we go back a long time. And he's got the quietness and the peacefulness of manner that I think helped me come out of that downward spiral and helped me confront some of these things where probably nobody else could have. And he knew her well. He knew Celeste very well too.
Well, you honored your wife also by accepting her decision. That doesn't happen all the time either with family members.
Right. That was
That's a
difficult.
tough one, yeah, it is.
But
Especially
It
with
wasn't-
the pain she was
she was not eligible. I mean, that was another thing, and she was not strong. And, you know, they could give her steroids that could bring her back, you know, to a joyful state, which was pleasant to see, but it couldn't last. It made her diabetic. There were all kinds of problems with it. So, you know, the writing was on the wall, and she knew it. And that's why she made that decision, I think. She did not want to prolong this for all of us.
I think your story is so unique because of this, the severity and the strength that you had through, the severity of the story and the strength that you had through your wife's passing. But then how natural it would be for your body and your spirit and everything to just be like, okay, I need a moment. And you talk about it like it was a spiraling downward and you were catatonic, but I think that was like probably a natural process that just needed to happen for you to kind of let the dust settle. And then the strength that you have and the courage through support, that second thing to come out of that and like now be here elevated to this state where you can share and help others is just like really, really a testament to your courage and your bravery and I'm so glad you're sharing it because it just inspires other people, I think, to help themselves, but then to rise up. And people who go through things like that and rise up are the grit, right? The
It
salt of the
changes
earth.
you in a way that is better. And it
If you
changed
let
me
it.
for the better in terms of my own knowledge of myself and others, my own feelings about my spouse and what we had, and particularly my consideration for my three daughters who are grieving as well, and my grandchildren, my 8 grandchildren, who some of whom are too young to really understand, and others who are old enough to understand, and who saw her, you know, even when she was in great distress, but they understood to some degree what was going on. Yeah.
And death is such a taboo topic. People don't like to talk about it. People don't like to admit that it's going to happen to all of us. And I just think it's such a beautiful part of life and can really enrich our life if we can come to terms with it. So I think speaking about death in that way is so important.
Michael recommended this Pema Chodron book, How We Live is How We Die, and it's very Zen, so it's a little unaccustomed to someone that was brought up with Western thought and theology and all of that, but it's got some very hopeful messages, some messages that seem a little odd, but taken as a whole, it was very helpful to me. And it talks about what happens when you die. Again, this is, some people consider this as wisdom, other people think of it as a theoretical possibility, and other people just say it's poo-hoo, you know. But it was helpful to me, and he picked that book, and that was a good one to pick. And Unattended Sorrow, I think, speaks a lot to what happened after she passed, and this downward spiral, and then trying to come back up. And I wouldn't say it's a guidebook for that, but it was very helpful. I underlined passages, I went back to it, I lost the book and then had to get another one. It was quite the journey. And then John Kabat-Zinn, I just like how he cleans his stove. So, why don't we pause for a moment and think about what we've talked about and said, and just do a sitting meditation briefly. Some people will call this sort of the 3-minute meditation. I'm trying to think of who calls it that, but it is, it's Zen et al. In this book. And it's meant to be short. It's meant to get in touch with your breath. It's meant to feel your body in this space and in this fellowship of people that care, people that feel empathy. It also helps one, I think, to recognize those areas of emotion that ought to be recognized. You may recognize this as part of rain, and rain was a real stalwart thing that we talked about and thought about. So we recognize and then we accept and we investigate in a curious, non-judgmental way of where we are. And we do this in our meditation, but perhaps we do this in our conversation. Perhaps we do this as we do walking meditation. There are so many ways. And then not identifying with the pain, with the emotional pain to the point where it subsumes you, but noticing that it is our thinking, and our thinking is not ourselves, that we have thoughts that come and go, and some we can analyze and some we don't. We also acknowledge, I think, that we have ways to deal with emotional and physical pain. And these are things that I used, things like blocking and responses to pain by drowning in it, just spiraling down was a drowning situation. And then finally turning toward. And that threesome is a sort of the story of a good portion of my journey in terms of the whole thing. And just think about that as we breathe, in breath and out breath. In breath for strength, in breath for energy, out breath for relaxation, out breath for sort of reconciliation in a way, in this microcosm of 3 minutes, a 3-minute meditation. I've got a handout that deals with the 3-minute breathing space. And some of you may have this, but I can't remember Michael handing this out, but he must have, because I have it, but I don't know when. So, okay. And this goes into more details of some of the questions that I might have asked when we entered into it. But if you ask those questions and then support some answers, you're no longer at 3 minutes. And but we could go over a few of these things. You know, what kinds of thoughts went through your mind, acknowledging thoughts as mental events, perhaps putting them into words. Sometimes I think it's helpful to equate those thoughts with sounds. For me, it's easier to take sounds that I can dismiss than it is to take thoughts that I can dismiss. And I suppose it depends on the sound. But I practiced that, and I think it made it easier to dismiss these random thoughts, particularly at those times when I sat down to meditate. And you know, my time was a mind that was racing and a time that was busy in my life, and all of these thoughts are kind of coming and going, like how do I deal with that? And then I pause to think about a sound and dismiss it, and then dismiss the thoughts. So how do you deal with that? We've talked a lot about dismissing thoughts and that sort of thing. Is there anything you'd like to share?
I think I mentioned before that some visualization, like getting some image in my head, and I guess for some people maybe it could be a person, but for me generally it was just like a nature scene or something, and just kind of, I don't know, that seems to help block out some of the busyness and some of the thoughts that are popping in.
Like a mantra,
Mantra.
a word or a phrase that I repeat when my mind is busy. And
What about
anchor
those hand?
and the mudras,
Yeah.
they usually come with some kind of a mantra that goes with the theme of the mudra.
Just gentle music in the background that helps.
Yeah, you found some nice, like background music, something very calming.
Or just directing your attention,
Mhm.
choosing something to focus on.
Like what?
Well, I was thinking like if I had physical pain, which is often the case, instead of mentally going like, oh, how long is this gonna last and where did it come from and am I gonna be like this forever and going down like this emotional spiral, I'll just focus on the pain and that spot and pretend like I'm breathing there to help alleviate the pain. If that makes sense.
Asking the question, what body sensations are right now, I think is part of a sort of a mini body scan. But the body scan is again a Jon Kabat-Zinn thing, which he kind of takes to a greater level in his book. You know, and quickly scanning the body to pick up any sensations of tightness or bracing or pain. Is something that we need to do, I think, more than ever when we're feeling pain. And visualizing an image. I had a lot of blood draws in my life, and I don't particularly relish needles, but from the very, very first times when this was happening, particularly when I was 40 and had that embryonal cell carcinoma, I would visualize a scene in the south of France that was a garden, and it was very quiet because the garden belonged to an order of Trappist monks, and so they didn't speak. And so it was always very, very quiet. And I was visiting there, and it would be a place where I would go to achieve some peace, because at that point in my life there was a bit of turmoil, not so much physical pain, but emotional pain, and it was a good place. And I still carry that vision of that place. And it's really odd to think of it this way, but I still carry its quietness. And that was the main thing, and the flowers and everything about that garden, formal garden. And then the step 2 of the 3-minute is gathering, redirecting our attention to physical sensations and of the breath, breathing itself, and then expanding the field of your awareness so that in addition to the sensations of the breath, you include the body as a whole, your posture, your facial expressions, and then any discomfort you might have. And that's the 3-minute breathing space. The other one I think some of you have, dealing with responding to emotional and physical pain, by Dave Potter, and it's this one here. And it talks about sort of 3 stages. And again, I recognize these stages to a great degree in my own life, in my own, journey over the past couple of years. And I was a real blocker. I always wanted to block things up, push it away, get it gone, and that was done mainly through diversions of various sorts. I would find something else to do, to think about, some activity perhaps, or whatever, and for minor things, it went away, and that was the way it was. And then there were things that couldn't be blocked, and by becoming aware of it, by paying attention to it, by investigating it, you almost got overwhelmed, and you started that downward spiral of drowning. And it was overwhelming, it was panicking, it was exhausting. Why me? I can't stand this, as the handout says. These are the questions that rise up and torment you, I think, when you're in this sort of state. And then, you have to sort of manage this before it becomes a never-ending cycle. You've got to recognize it if it's a cycle, and if that is happening and it's overwhelming, you need to be able to let it go. Just say, not now. I'm going to put it to the side. I think during my caregiving, there were times like this, but I had to put it aside because I needed to be present for the caregiving. And that was vitally important with regard to her care and her moods and her own quality of life mentally, but also in terms of the medications and good nutrition and all the other things that needed to be considered at that time for her well-being. And so letting it go and then returning to a different state of, in this case, it wasn't really a diversion, but it acted that way, I think, on my own psyche. The turning toward didn't happen until after. And after she passed, at some point, I was able to turn toward. I guess there's an element of turning toward while I was her caregiver, while I was caring for her, because we were certainly within each other's orbit, mentally and emotionally and in conversation, in feelings in many ways, but turning toward this downward spiral, that had to be a real turning toward that particular state, that particular anguish of losing my very best friend, losing my companion, losing the person that I had children with and that shared my life. That just is unbelievably painful, and to turn toward that is very, very, very difficult. But in doing so, it provides a sense of a minor little bit of hope, and it provides a little bit of joy in that it takes you back to what you're missing. And what you're missing are the good times. And you're missing the wonderful feelings you had for each other. And the more you kind of turn toward it, the more you see that, just sort of this drowning downward spiral just goes on and on and on, and it doesn't really lead anywhere. It doesn't lead to any peace emotionally. It doesn't really lead to much in the way of understanding. You have to be more rational to have that understanding. And that's sort of how I approached it. And I found this to be helpful more after the fact, even though I had it since the first time with Michael's sessions. And there's a number of approaches to turning toward it, including RAIN, which I indicated we did quite a bit, and it's sort of a step-by-step investigatory methods, but to recognize, accept, investigate and not identify with. I think next, sometimes we are taken aback by what comes our way. And Michael suggested that I read this poem, and I think he may have read it before in one of the other sessions. Having taken 3 of these things, it kind of blends together. And then our conversations at home or wherever, often involve stuff like this. So, but it's Transforming Unhappiness, and it comes from the book by Williams, Teasdale, Siegel, and Kabat-Zinn. And it says, "This being human is a guest house. Every morning a new arrival, a joy, a depression, a meanness. Some momentary awareness comes as an unexpected visitor. Welcome and entertain them all, even if they're a crowd of sorrows who violently sweep your house empty of its furniture. Still, treat each guest honorably. He may be cleaning you out for some new delight. The dark thought, the shame, the malice, meet them at the door laughing and invite them in. Be grateful for whomever comes, because each has been sent as a guide from beyond." That book has a lot of things like that. And that's one of my reasons for recommending it, for bringing it up. So there's depression, there's anxiety, there's loneliness, and there's physical pain. And I think Michael would certainly be talking about the gate theory of pain. And I think that he's more qualified to discuss that than I certainly am, in the sense that he knows the mind and the body more than I certainly do. He is a physician, he is a doctor. I'm a doctor of earth science. I can talk about earthquakes and volcanoes and stuff like that, but I don't know quite how the mind works, but I'm working on trying to find out how my mind does. But I think I certainly encountered depression and anxiety, certainly loneliness, and grappled with those things. And it may be that it's wise, when one talks about and thinks about and meditates on difficult subjects, to look for the joy, to find a way to find some joy, to maybe meditate on that. And I think maybe we should do a meditation on joy. Notice your breath as you've been noticing it all along, but maybe look a little harder, a little bit more specificity. The breath coming in, the breath going out, the way you feel, the way the body feels with your breathing. Is the breathing in your chest? Is it in your belly? What sensations does it arise? What does it feel like on the sides of your body? You feel the breath entering your nose or your mouth. You feel it filling your lungs, maybe making you feel whole. While you breathe, bring to mind a pleasurable experience you've had recently, one that carries a positive emotion, such as happiness, joy, comfort, gratitude. keep that thought with a few breaths in and out. And then let go. Think of other pleasant, joyful experiences or images. Explore those thoughts. And then let them go. And we all have a store of these pleasurable times. You just need to stop and pay attention, and then let them go and welcome the next one. Just like the guests in the house will come. Sometimes the guests are gentle and helpful, not just bringers of pain. Think of that joyful and pleasurable sensation in terms of your body. Where do you have this feeling? Is it large or small, pointy or diffused? Does it provide comfort to that part of the body? Is it gentle? Is it something you're grateful for? Is it something that, in your loving kindness, you would wish for someone else? And then let that thought go and return to the breath. Our time is almost up. Is there anything you would like to share? I'll stick around if anybody wants to chat afterwards.
It was my mom's birthday yesterday, and I sent a note to my siblings. I said, well, in honor of Mom's birthday, let's share some memories of Mom. And so, you know, the first 2 or 3 came out of 6 of us, and they said, why haven't you done this sooner? Shouldn't we do this for Mother's Day, Father's Day, da-da-da? And I says, well, you know, my brother's birthday is March 23rd, let's put him up on the docket. You know, so that was, like I say, but now I'm thinking of somebody that's ill, or their husband just had surgery, and it's like, well, how can I make her feel happy? You know, what moments, what pictures should I send her to keep her spirit up? You know, and I do have those. So, I mean, I didn't think of that until tonight's presentation, so thank you. You know, just taking those steps further. Good.
Do you suppose you're better for having gone through it?
In many ways, yes. I think in terms of being able to think through complex and difficult things, it has helped me. I think it showed me a new path for emotional development in positive ways, and it's given me more patience, which I was always a very impatient person and very driven, very success-oriented, and backed off on that and found new things that are much more worthwhile. And, you know, I'm retired, I'm not in the swirl of the work world or anything like that, but I'm slowing down a bit and considering life more than I was before. In some ways, physically, I think it damaged me. And that's going to happen when you have such a very long time of unbearable stress. But, you know, I'm gonna, in 2 months, I'm gonna have the heart catheterization, and so that should be on the mend. And then after that, I'm gonna get the shoulder replaced. And that'll be in 3 months. And we've got a plan with all of my providers to get through this. And it started last week, and I met with both of them from both, you know, the here and the here. And it's a plan, and I think it's gonna work, and I'm hopeful. But if it doesn't, I know I can live with certain things, and you know, I hope to get back to yoga and not fall off to the side.
Right.
And you know, I see great benefit in it, and I think that that would be something I definitely want to do, particularly when this is fixed. The AFib is just going to make my heart weaker. I'm on something now that prevents the stroke, but the very rapid heartbeat that goes with the AFib is not good, and so it's got to be dealt with. And so, you know, the Watchman, which takes care of the threat for a stroke, is not what I need right now. I need the thing where they go up through the artery and they electrically block those areas that are sending bad electrical information to the heart. I mean, if you're talking about the heart, you're either talking about plumbing or you're talking about being a plumber and an electrician. Of course, that comes from my cardiologist. I didn't dream that up. But anyway, my problem is electric. There doesn't appear to be any problems with the plumbing, which is good news. No problems with the valves or any of that sort of thing. So, but ultimately it could turn out to be that way if I didn't do anything about the AFib. So I'm getting knowledgeable about it. I'm learning to be, I think I definitely learned how to talk to doctors over this whole thing. And what to ask, what not to ask, what to ask the other people, what to ask the nurses. You know, you get different stories with different people, and then most of all, what to ask the patient, and in this case, it's myself.
And you're at an advantage because you know the sensation now. But
That's
there's
right.
other people out there that don't know they have this heart, so you gotta move on that.
Yeah. Mhm. The funny problem was that I didn't know the sensation,
Right.
in the sense that there was just no outward evidence of it. It was my watch that told me I had AFib. And the cardiologist, you know, I went to the cardiologist, which the watch tells you to do. He was not particularly thrilled to be upstaged by the watch. You know? And so he says, we'll get an EKG and we'll get real data. You know, not something this Apple outfit has as an imposter. Put me on the EKG, he says, you're an AFib.
Your watch was right.
That was right. And not only that, it takes care of data logging, the rapidity of your heartbeat, and when the AFib is happening. In my case, it's happening all the time. But they've got a good record of my heartbeat. I can push a few buttons on my phone, and my phone will show a chart of that. And it's meaningful to these people. And so I started using that. I got a different cardiologist than the one that didn't like the watch as an instrument of knowledge. But, you know, that's just a funny story with that. But, you know, my kids bought me the watch because they were worried that if I fell down, the watch would alert them. And it's got that feature. And of course, you can wear it in the shower, so, you know, if you fall in the shower or something, you know, so it's a good thing. I really like the analog watch and I miss it, but, you know, if you wear two watches, they question you. So, here we are. Thank you very much for your coming tonight and for
Thank you.
participating.
For,
And maybe someday in the future, we'll see each other again.
But not in
Hopefully
jail.
not in jail.
No.
Unless you're both teaching meditation.
Yeah, right. Michael may ask you how I did, so that's up to you, but
We can tell him right now if he's watching.
yeah, if he's watching, sure. Yeah, he'll hear it, I think, for sure, so.
Yeah, I think it's been going, yeah, hour 6 minutes.
Okay, that's about right, yeah.
Yeah.
Well,
For sharing your
he
story.
gave me good resources, he gave me good advice in terms of being my tutor, my prime person of knowledge for this whole topic, and he gave me the handouts.
Well, it's one thing to have the handouts in the book and the theoretical knowledge, but it makes it more valuable and more rich when it goes with the real life experience.
You're checking it off,
Knowledge
yeah,
that you
that's
can-
what it was, that's what it was, you're
Yeah.
identifying,
Right.
yeah. Gotta need
Well, it's hopeful that it's helping other people, and, it was hard to necessarily recognize that right away, that it was helping me, but I'm glad I did, because as soon as you realize that, then you realize how much it can help.
Mhm.
It's when I was at our fingertips.
Yeah.
For us to help.
Have you ever heard of Reiki?
I have not.
So Reiki is energy work. If you've heard of acupuncture, that's all based on your energy system. And more Western medicine. I mean, I think even at Aurora, you can get some dry needling done, which is similar to acupuncture, but it's based on the energetic system of the body.
I had dry needle here
Uh-huh.
at Ascension.
They tend to use it more for the physical body and for physical pain, whereas acupuncture, oftentimes the needles go in places far from wherever the physical pain might be, because it's all based on meridians, and Reiki is just another form of healing energy. And after what you've been through and thinking about your heart and there's probably parts of your energetic body that are blocked and.
Who offers that around here?
Well, I've done 2 levels of Reiki, and my master Reiki class will be in November. But I can definitely, share some people with you that do it, and they don't touch you, you're fully clothed, it's all, sensing, you're trained to sense
Mhm.
energy blockages, and.
I had some very good experience with occupational therapy here, and in conjunction with my sports medicine person, which is the guy that's dealing with the shoulder. He's not gonna do the surgery, but he was dealing with it with cortisone shots and certain kinds of exercises along with the OT here. And she tried the dry needling, and it was very, very painful for me. But the muscles were really tight, and she knew what she was doing, where she was doing it. I just couldn't stand
I've
it.
heard that the dry needling, literally, they put the needle right at the spot of the
Absolutely.
pain.
Oh,
and
man,
it's
it was just
intense.
terrible.
Yeah,
But she
acupuncture's
did
not-
other kinds of things that were very helpful.
Yeah.
And then this latest time, the cortisone didn't help. Her physical therapy or occupational therapy didn't really help to the point where it lasted. And then I went back to him, and he gave me a shot in this delayed action beads of cortisone or something like that to get me through the 3 months so that I could get the heart taken care of. And so that's sort of where I'm at. And he was in conjunction with my cardiologist, so I'm glad everybody's on the same page.
Yeah, I would choose
And they're in
one
2
first.
different places,
Yeah.
one is at St. E's and one is at Fredert, so, but I mean, Fredert is a very,
That's where you're going for your heart.
for the heart, yeah, and that, and I'm not sure exactly where I'll be going for the shoulder. It's a specialist that deals with shoulders, and I don't know if it's gonna be, whether it's gonna be, I guess robotic, or whether it's gonna be straight. I've gotta meet with that guy and find out what it's gonna be, probably next week. I haven't gotten the date yet, but I'm looking forward to it. This has been a problem of long standing. I whacked this thing into a very hard outcrop of rock, and it's been giving me trouble off and on ever since. And it's just, I was in a cave, nobody heard me scream.
Truly?
Yep, and they took the rock out too, it's at Ledgeview, and it no longer exists. They got one of their guys in there with some black powder and bang, and it was
Show
gone.
that rock.
Yeah, right.
That's the last time you cause an injury.
Oh, yeah. Okay, well, thanks again.
Thank you so
Thank you.
much.
Again, if you wanna take a look at these books or take pictures of any of them, they're up here, I'll stick around and let you do that if you want to.
I can probably tell now to come and shut the camera off.